here's a good case history. Okay, so this guy comes in to me, and he has horrible back pain. He has pain shooting down his legs. He's already seen a few other physicians to have PRP, and it really didn't help him that much. He's already been through the epidurals and everything else, and the chiropractor, and some of the other doctors that gave him PRP injected him right into this herniated disc here, and it really didn't help. Completely uncomfortable, couch-ridden, okay? Terrible. But again, if you look at the MRI, what are you going to do? Say, okay, we need to get a discectomy, right? Your spine shifted here, you need to get a fusion. Those would be the traditional options when all else fails. However, it's not always the disc. There's a lot of other things in the back that can cause the pain. So you see over there, there's something called the piriformis. The piriformis is a muscle that essentially runs from around where your coccyx is, which I think most of us know where that is, over to the hips, which I think a lot of us know where that is also. And guess what runs through the piriformis? Sciatic nerve. So that's one way of many that you can get sciatica. You can see here, these are a lot of different muscles and fascia of the back, and all these fibers can get microscopically torn. Now, if we go back to this, can you really see any of that there? No. Now, obviously, this is a sideways view, but I can tell you if you look at the other views that are cut different through the human body, you really can't see damage there in many, many cases. But if you examine someone properly, you can feel the damage all along here. Okay? And this contributes to a huge amount of back pain. Here's a really good anatomical model here, and you can see how the ligaments run up from the lower part here, where this is the sits bone, run up through the hip, run up through the sacrum and SI joint, which I'm sure a lot of you heard on that, and they insert into L3, L4, and L5. The way I like to describe this to people is this is like the Eiffel Tower, okay? To where the spine is the long part of the tower, and the hips are at the base of the tower. So what happens with the Eiffel Tower? You start loosening the screws. The whole structure will wobble and compress, right? However, if we only fix the top of the tower and leave the bottom of the tower alone, what's going to happen? Probably you fix part of the problem at best, okay? That's why a lot of times when patients have spinal fusion, certain things have gotten better and a lot of other things are left untreated, okay? Because again, you need to fix all the parts, not just some of the parts. Here's another disc. So with this patient, he had numbness down the leg, had back pain, debilitating, wasn't really able to do what he wanted to do, and he really didn't want surgery. He had had this off and on for years, relatively young guy. And you can see where those arrows are, that's the disc bulging out, and it's pressing on the nerves. So what did I do? We treated him with PRP, but I did not necessarily treat him into the disc. I treated his structure. I fixed the pelvic tilt. He had a repeat MRI, and what does it show? The disc is back where it belongs. But I didn't touch the disc. So go back to that Eiffel Tower analogy. So if the tower is loose and collapsing, and you re-strengthen it, what happens to all those cross members? They regrow. The disc is kind of just a cushion. That's what it is. It's a cushion in the spine. But all the structure around it isn't well seen on the MRI, but that's what we fix. So if you have a bad structure and you fix the cushion, you leave the structure alone, you don't get better. But if you fix the structure and repair it, then what happens to the cushion? Just like that Eiffel Tower, you have a low cross members, you fix them, the cross members start to go like this. Rebuild, the disc can just go back in.